Okay, as we are heading into the fall, I want to talk about allergies, but I also need to have a little conversation about mold. Mold can be something we can talk about all day. This is just touching. And this was brought, we're bringing mold to light because people in the western part of our state have been affected by flooding. And as always, our heart goes out to anyone uh, that has been affected by water damage or flooding. Um, I want to also talk a little bit about safety. Our primitive brain, our lizard brain, needs to know that we are safe. Um, that is part of our immune system. And when the lizard brain is not feeling safe, often the immune system, the allergy part of the immune system, is overreacting. So that's the connection here between allergies and the primitive brain or the limbic system. So, things that we can do to practice safety to control our allergies are continuing to practice gratitude. When we have these worrying thoughts about our current situation, interrupting those thoughts, looking outside, saying, "Oh, what a beautiful day! Look at the beautiful flowers or leaves." And as always, taking a deep breath and calming ourselves down to calm our immune system. Now, I do want to talk a little bit about mold. It can be allergenic. There are some molds that we definitely know cause sneezing. But we also have to talk about the toxins that molds produce that we can be allergic to, but the toxins are also what can cause some other symptoms, especially brain fog. Now, mold needs moisture to grow. It also needs a food source. A food for mold is commonly the leaves that have fallen down on the ground, or debris, whether it is uh, uh, sticks or something in our home, such as sheetrock or dust. So we have to control the humidity as well as the debris. Humidity, we like to keep that below 50%. And there are these nifty little devices that are called ergometers. I had found this set of three on probably Amazon for $30 that you can sit in each room and measure the humidity as well as the temperature. Often a crawl space or basement is a concern. And we don't want to walk down in the basement all the time. So there are ways that you can get these remotes that I've got circled here that you can put into a basement or crawl space and monitor the humidity down there. If you have high humidity, you may need a dehumidifier. Honeywell is a brand, Malia is a brand. There's a lot of different brands of dehumidifiers. And it needs to be a pretty good strong one. They run around 150 to $200 for a good dehumidifier, and it's based on the size of your room. So a smaller room, like a bathroom, could use a smaller dehumidifier. Whoop. Um, Pollens and mold spores are kind of like glitter. They're everywhere, and pollen from the ragweed, it gets in your hair, it gets in your nose, and just like glitter does, and we can't get rid of it. I find glitter for my daughter, 3 months later, and I like you just it's everywhere. Um, and so after we have been exposed to mold spores or ragweed pollen, let's think about what we can do to clean up after an exposure. Washing your hair before you go to bed because you've got that stuff in your hair, then your hair is on your pillow and you're turning your nose into the pillow. So let's wash your hair if you've been outside in the ragweed or if you've been exposed to mold spores or toxins. Outside clothes, take them off as soon as you come in, leave them outside. Rinse and remove the pollen. Wash your hands, wash your clothes, rinse your nose. Frequently, we'll talk about saltwater rinses. Uh, McNeil is a company, but there's other companies that have ways that you can have water and salt, and you can squirt it or spray it in your nose. It needs to be distilled water, not boiled water. And sometimes people find that a slightly warmed water feels a little bit better. So rinse in the pollen or the mold out of your nose. Frequently, we'll even use something called xylitol. You can get these already prepared in most drugstores. Xylitol is a sweetener, but it also kills bacteria, fungus, and virus. And it also breaks up mucus. So sometimes one of these as a treatment afterwards, or even if you are having some nasal congestion, can be helpful. Can't talk about allergies without talking about histamine. This is something our body produces in response to something foreign. Um, Histamine tells our body to make mucus and wash whatever that is away, sneeze it out, push it out. If it's maybe a food, our body's going to produce more stomach acid to break it down. We can get swelling, like inside of our nasal tissues, as the body is trying to bring more blood cells into the area. And if it's with the eyes, often we get itching of the eyes. When someone has got a high level of histamine circulating in the body, we'll often see dermatographia, where when you scratch your skin, it turns red and it can even whelp up a little bit. So if you're wondering, oh, my symptoms is this histamine, you can do the skin scratch yourself. Histamine is an inflammatory chemical and it goes everywhere in the body, and then produces the symptoms that we just talked about, the sneezing, the swelling. So we'll often take an antihistamine to help with those symptoms. Um, and during seasonal allergies, certainly feel free to take these. We don't want people taking them forever and ever. We want to try and resolve the underlying issue. But if you need an antihistamine, there's Claritin, Zyrtec, Allegra. Those are longer acting and non-sedating. Benadryl does make most people sleepy, so we recommend that at night. But we also have to remember Pepcid. That is a something to decrease stomach acid, but it is an antihistamine. And it's a different class. It's what we call a histamine too. Sometimes people will need Pepcid in addition to Claritin or Zyrtec. We also need to think about high histamine foods. If you're in a high histamine state, let's not add more histamine in our foods, such as leftover or older foods. Um, if you're in a high histamine state, you may want to eat your leftovers within 24 hours, or freeze it. Fermented foods, beer and wine, but as well as the kombucha, sauerkraut. Those are going to have high histamine, so you may, when you're in a high histamine or an allergic state, want to say no thanks to those just for right now. Aged meats, especially fish, cheese, and tomato products that we buy. They usually take the older tomatoes to put in tomato sauce and ketchup. So the older produce is going to have more mold and mold spores. So it's not the tomatoes' fault, it's the age of the tomatoes. So if you are in a high histamine state and you can tolerate tomatoes, go for the fresh ones, not the canned. Food as medicine, one of my favorite things to talk about. We can use ginger and turmeric. They are natural antihistamines and anti-inflammatories. So think about bringing these in during allergic periods of time. You can use them to make tea. You can add them to your cooking. You can take them as supplements. However you want to get these two spices. They also work very well together. N-acetylcysteine, or NAC, are components of broccoli and cauliflower and other cruciferous vegetables like Brussels sprouts. N-acetylcysteine breaks up mucus. We've used it in conventional medicine for years in kids with cystic fibrosis to help break up mucus. That's a congenital condition with lungs and mucus. NAC from vegetables is also important for removing toxins. It helps our body make something naturally called glutathione to get rid of toxins. So bring these cruciferous vegetables in during allergy season. Isn't it also kind of interesting that these vegetables are in season during the fall, during allergy season? Quercetin is a natural antihistamine. We see it in apples and onions, but it's hard to eat enough of those to get enough quercetin. So sometimes we will use it as a supplement. I will just make a note here that in higher doses, some people get more anxious in it. So we need to be aware that we may not want to push the dose up to 3,000 milligrams in somebody with some certain genetic variations. Supplements. They work, a lot of these nutrients and herbs work well in combination. And we may need to have a little bit higher doses than just what we would get from food. So I'm going to give you some examples. You don't have to use these, but I'm also going to show you dosing options. Some of these we do carry in our office or on full scripts if you need a good resource. There are always other good options available out there. Okay, so D-Hist is one of the ones we keep in the office. It comes also in a kid's chewable version. This one has got the quercetin. It also has the N-acetylcysteine in it. And this is just a good dosing example. For 2 capsules, this is about 400 milligrams of quercetin and 50 of N-acetylcysteine. This particular one also has bromelain, which is a derivative of pineapple. So if people are sensitive to pineapple, we may not use this one for them. Hist Reset is another one. It also has the pineapple in it. Some of the ones that don't have pineapple, Th2 modulator, this one also has quercetin. It also has another, it's really a weed. It's called perilla, and there's a picture of it up there. It kind of looks like mint. It is really, really good antihistamine. So that's a good combination as well. So those were just examples. So here's a summary: fall, allergies, and mold. First, clean up your diet if you've been exposed or not feeling well. Think about supplements such as quercetin, NAC, or perilla. Rinse and remove the pollen. Rinse your sinuses, rinse your hair, take off the clothes. Food such as broccoli and ginger. And remember, this is a joyful, grateful season as we're heading into fall and Thanksgiving. So don't be afraid of it. Enjoy it, relish it. But we also want to give you some tools to help you be healthy. So with that, I am going to stop sharing and come back to you and stop